Despite the availability of an effective vaccine, over 200 million people have chronic hepatitis B worldwide. Chronic infection occurs when hepatitis B virus, or HBV, remains in liver cells. Proteins on HBV's outer layer, known as the viral envelope, trigger immune tolerance, which allows HBV to survive in the liver due to the virus exhausting the immune system and preventing it from responding. This causes chronic infection that can only rarely be eradicated. If left untreated, chronic HBV infection may lead to liver damage, cancer, and death. There's an urgent need to develop a cure. Neutralizing antibodies recognize the viral envelope proteins and eliminate viral particles. Vaccines trigger these antibodies, protecting against HBV. Passive antibody administration also protects against infection at birth or reinfection after liver transplants. Professor Mario Mondelli and a team of researchers at Pavia University have isolated a fully human monoclonal antibody called ADRI2F3 from a vaccinated individual. ADRI2F3 binds to HBV's viral envelope, neutralizing the virus. Besides passive immunization, ADRI2F3 can eliminate HBV particles and envelope proteins to break the immune tolerance, restoring the normal immune responses against HBV that may help eradicate it from the host and treat the disease. ADRI2F3 is patented in the US, Canada, most European countries, as well as Singapore, Australia, and New Zealand.